that they're moving from being contractors to being salaried employees, and that the actual majority will see their overall compensation go up. There are some who may see their compensation go down, and of course it's about making sure that there's a reasonable workload balance around the number of hours worked, and I think that that's probably part of where the frustration is. Of course, I want to honor that there are some that are feeling frustrated through this process, and one of the reasons I've raised this with Alberta Health Services as an item earlier this week is because this came to my attention through their past correspondence, and I will continue to talk to Alberta Health Services. Of course, we want a respectful, smooth transition in the end. So I think a lot of it's around having reliable employees who are working the same number of hours. So employees, from what I understand, will be guaranteed a certain number of hours, and I think that's 50 hours, as opposed to right now as a contractor, you could have more hours one week or less another. So overall, it's about providing that consistency to the employee, but also to the patient, and ensuring that patients have access to these medical professionals. And I want to say that I'm really glad that we do have the program. It's only Alberta and Manitoba that have a program like this to help transition newcomers into a field that's related to their prior experience in other countries. I hope that they continue to work with AHS and try to find a resolution, and I'll continue to do the same in terms of making sure that we're working to be accountable to the confidence of patients in the communities. In terms of transitioning from being a contracted employee to or a contractor to an employee, of course there's challenges, and I am going to continue having conversations with Alberta Health Services because of course patient safety is the #1 priority.